Good morning. I'm Dr. K, and I'll be giving you your cranial nerve exam today. Can you just confirm your date of birth? And what doctor were you referred by? Okay, so your primary care physician. And have you ever had a cranial nerve exam? Okay. So just a checkup, and you've had one before, okay. And what is your home address? I don't see it listed here. And any health issues you've experienced recently? Any head trauma, headaches, dizziness? Okay. Perfect. So just a few short questions before we start. Can you tell me who the first president of the United States was? Very good. Can you tell me today's date? Good. And what city are we in right now? And are you familiar with what the cranial nerves are? Okay, so they're actually a set of 12 paired nerves that arise directly from the brain. So I'll be assessing some of those nerves today during this exam. And I think we're ready to go. So I will be starting off first looking at your ocular nerves, your eyes. And when is the last time you had an eye exam? Okay, so not too long ago. That's great. And do you wear glasses? Okay, and any eye issues in the past? Trauma, glaucoma? Okay, perfect. And I'm just going to have you look directly at me. Very good. And just follow this light for me right here. Okay? Just follow it wherever it goes. Just with your eyes. And not with your full head. Just with your eyes. Good. And then I'm just going to look a little closer. Very good. Can you look up for me? Good. And now look down. To the left, and then to the right. Very good. Alright, perfect. So your pupils look normal, so I don't have any concerns there. And now I'm going to have you just look at the wall directly behind me. And I'm going to look at the sides of your eyes. So just look right behind me. I'm just gonna look right over here first. Okay. Look right back here. Okay. Very good. Doing a great job. And you said you sometimes wear reading glasses. Okay. And do eye issues run in your family at all? Do either of your parents wear glasses? So I'm going to now have you just look at this chart for me. So first cover your right eye and tell me the smallest line you can read. Okay, and can you go any lower? No? Okay. Can you tell me what this color is? How about this one? Good. Now cover the other eye. And now, let's see, can you still read this line? Okay, what about this one? Okay. What color? What color? Good. And then I just want to measure your pupil size. So I'm going to use this chart right here. Just look at me for 1 second. And I'm just going to check. Okay, perfect. Good. Put that down. And next I'll be checking your peripheral vision. So just look directly right here at my nose and just tell me what hand I'm wiggling my fingers on. Okay? So left or right. Good. 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 Okay. So now a few color tests. So let's see, I will do this first. So I'm just going to draw a few shapes in different colors. And then I'm going to have you tell me what color they are. And these aren't the best drawings, so I'm sorry about that. What color is the circle? Very good. Very good. Purple. Let's see what next. What color is the square? Perfect. Orange. Okay. What color is this heart? Good. Pink. What color is this rectangle? Perfect. And now a little bit more in depth. So I do have a color blindness book that I like to use for my patients just to double check and make sure they're not having any issues. So I just need you to tell me what number you see in each of the images. So we'll start with this one. So what number do you see in this image? Can you see? Very good. Number 8. And now if you would have had any red, green deficiencies, you would have seen a 3. And then if you were colorblind, you would have seen nothing at all. This one. What number do you see? Very good. It's a 5. And then if you had red-green deficiencies, you would have seen a 2. And then nothing at all if you had an issue. Let's do maybe one more. Can you please, with your finger, just trace whatever line you see in this image for me? Just hold it right here. Just gonna watch. Okay, very good. So you traced it properly. And now if you had an issue, you would have traced it outside the pattern. So, very good. That's all I'm going to test. And I don't see any issues with your eyes. I would just recommend going back for another eye exam in about 6 months, since that's when you'll be due for your next one. So now I'm going to test your body movement and your strength a little bit. So first I need you to just open your jaw wide for me. Very good. I'm just gonna feel both sides. Any pain? Do you suffer from any teeth grinding issues? Okay. Yeah, I don't hear any clicking. Can you turn your head to the left? Okay, turn it to the right. Good. Can you open your mouth? Good. And now just swallow for me. Good. No pain when you swallow. Okay. Now can you stand up? Good. And then just walk toward me. Good. And then walk back. Perfect. Now can you just push my hands away? Good. And now pull them toward you. Good. Now with your coordination, I'm just going to do a quick test. Can you touch your nose and then touch my finger? Okay? Good. 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 Perfect. Now for your eyes. I'm sorry, I meant your ears. For your ears, I just want to take a quick look inside. Do you get your ears cleaned at all? Okay. Perfect. So let me take a quick look. And do you have any history of ear infections? Okay, good. Alright, so just turn your head. Perfect. I'm just gonna look. I don't see any swelling. I don't see any inflammation or redness. Tympanic membrane looks great. Can you turn your head? Same thing. No swelling. No redness. Eardrum. Looks fine. So just one quick test. I'm just going to whisper a few numbers on your left side and then your right side, and I just need you to repeat them for me. So, here we go. 2, 4, 13. Good. Very good. Yes. Let's see what we do next. Alright, so now a nose test. I just want to make sure you can smell everything properly. So have you lost your sense of smell at all recently? Okay, so just a few years ago, and it's been good since then? Okay, so can you just close your eyes for me and then hold one of your nostrils closed? I'm just going to put a scent under your nose, and I need you to tell me what it is or what it smells similar to. So here's the first one. And what do you think that is? Very good. Yeah, so it's just a very strong floral scent. And now can you hold the other nostril closed? And I'm just going to place this under your nose. Very good. Yep, this is just a bag of coffee, and it does smell amazing, so very good. And then if you were to lose your sense of smell or taste, obviously in the future, you can let us know, and we can examine you. But obviously everything seems fine now. But let's test your taste. So have you lost your sense of taste at all? Okay, so just a few years ago again, but it's been good? Good. So I have 2 sets of drops, and I'm going to just drop them on your tongue. You're not allergic to anything, right? Okay. So one's going to be a salty taste, and one's going to be a very sweet taste. So just let me know which one it is. Just open your mouth for me. And which one is that? Yep, it's the sweet one. And so now this next one should be salty. Let me know if you don't taste any salt. How's that? Very salty? Okay, good. Good, good, good. Then we are almost done. Just a few sensation tests next. So the first is using a water globe. So these are used a lot with facials. They feel really good when they're cold, kept in the refrigerator. You can put them under your eyes or just roll them around your jaw. Really nice for relaxation. But for today's purpose, I'm just going to have you close your eyes. And I'm going to just touch this on different parts of your face, the left side and the right. And I just need you to tell me if you feel it on the left or the right side. Okay. Alright, so here we go. Good. 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 Very good. And did you have any issues feeling the cold sensation? Okay, good. So the next I will do a rough versus smooth test. So you're going to feel either the rough side of this cotton swab or the smooth side. So just say rough or smooth. And I'm going to do a little bit on your shoulders too. Good. 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 And now for this next one, can you just tell me if you feel 2 points or 1 point on your skin? Okay. Good. 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 Very good. And lastly, one more, sharp or dull. So you're just going to feel either this sensation again, which would be dull, or this, which will be sharp. But don't worry, it's just a very, very light sensation on your skin. It won't hurt. So here we go. Good. 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 Wonderful. Well, I don't have any concerns at all about your sensation. In fact, you passed every test perfectly. So, wonderful job. So, based on the results, you are neurologically very healthy, so I do not have any concerns at this time. I'm going to send my findings to your primary care physician, and I know he wanted you to come in once a year. So you can either make your next appointment at the front desk or just call back in 1 year, and I'd be happy to give you this exam again. But like I said, nothing abnormal from the exam, so you are in great health. And please come back anytime if you'd like to get checked out, or if you of course have any trauma, any accidents, we can definitely do another exam for you. Okay? Well, thanks so much for coming in, and feel free to call if you need anything. Take care.